Imagine a world where brain surgery no longer means scalpels, stitches, or scars. Where patients walk out of the hospital the same day they enter, without a single incision on their heads. This isn't science fiction, it's the remarkable reality unfolding through focused ultrasound brain surgery, a revolutionary medical breakthrough that is redefining what's possible in modern neuroscience. For decades, surgeons have dreamed of treating the brain without cutting it open. The brain, the most delicate organ, has always required the most invasive operations. But now, using sound waves, doctors can target deep areas of the brain with pinpoint precision, destroying diseased tissue or calming overactive neural circuits, all from outside the skull. The technique harnesses high-intensity ultrasound beams that pass harmlessly through skin and bone, converging on a single focal point inside the brain. There, the energy generates heat strong enough to ablate or alter tissue without damaging the surrounding areas. No scalpels, no blood, no stitches. For patients suffering from essential tremor, Parkinson's disease, obsessive-compulsive disorder, and even depression, this innovation represents hope where medication and traditional surgery have failed. It is the meeting point of physics, neurology, and compassion, turning sound into healing. The story of this transformation is not just about technology, it's about courage, research, and the unshakable human desire to heal without harm. The journey toward incision-free brain surgery began decades ago when scientists first experimented with ultrasound to heat tissues deep within the body. Initially used for treating cancers and uterine fibroids, researchers soon wondered, if ultrasound can focus energy through layers of tissue, could it also treat the brain? The challenge was the skull. It distorts and scatters sound waves. But with advanced MRI guidance and computer modeling, engineers learned how to correct for the skull's shape and density. The result was a system known as focused ultrasound surgery, FUS, guided by real-time magnetic resonance imaging. MRI provides exact visualization of the brain's anatomy and temperature, ensuring the procedure's safety and precision. The patient lies inside an MRI scanner wearing a helmet filled with cool water to transmit sound waves evenly. Hundreds of ultrasound beams converge at a precise spot, so accurately that the margin of error is less than a millimeter. The energy at that point can destroy malfunctioning tissue or disrupt neural pathways, causing tremors or obsessive thoughts. And because only the targeted spot is heated, everything else remains unharmed. This blend of physics and medical insight has turned science fiction into reality. The first FDA approval for focused ultrasound brain treatment came in 2016 for essential tremor, and since then, its applications have expanded rapidly. Today, it's being explored for epilepsy, chronic pain, and even Alzheimer's disease. Each success represents years of research, testing, and hope, a story of relentless innovation guided by the dream of healing without cutting. For patients, the experience feels almost surreal. Imagine walking into a hospital terrified of brain surgery and walking out a few hours later, tremor-free, with no incision, no blood loss, and no lengthy recovery. A typical focused ultrasound procedure begins early in the morning. The patient is awake and communicative throughout, allowing doctors to monitor progress in real time. Using MRI images, surgeons identify the exact target deep within the brain, often an area responsible for uncontrolled tremors or involuntary movements. The ultrasound energy is gradually increased during test sonications, producing temporary effects that confirm accuracy. Once the perfect focus is confirmed, a final, higher dose is delivered, permanently treating the target tissue. The patient may immediately notice their hand steadying or their voice calming, a moment of astonishment both for the patient and medical team. Unlike conventional surgery, there are no wounds to heal, no infection risk, and minimal side effects. Most patients return home the same day, resuming normal activities within 24 hours. It's an emotional transformation as much as a physical one. Many patients who once struggled to hold a cup of coffee or sign their name now regain independence. Families watch in tears as years of suffering vanish in an instant. For them, this isn't just medical progress, it's a miracle shaped by science, giving dignity back to life. Behind every success story is an extraordinary collaboration between scientists, engineers, and physicians. The pioneers of focused ultrasound spent years refining the technology. One key figure, Dr. Neil Castle, founded the Focused Ultrasound Foundation, which has become the driving force behind research and awareness. With support from organizations like the University of Virginia Health System, Stanford Medicine, and global partners, the foundation has pushed the boundaries of what this technology can do. The principle seems simple: sound waves focusing to heat tissue, but making it work on the human brain took thousands of experiments and billions in research. MRI thermometry allows real-time monitoring of temperature inside the skull, ensuring no damage to surrounding tissue. The software adjusts each beam's intensity to compensate for bone thickness and density variations. The system's precision is such that it can target an area smaller than a grain of rice deep in the brain. These technical marvels combine to produce a procedure that feels almost magical. Yet it's pure science, pure engineering. Every line of code, every calibration, every MRI scan contributes to a patient's ability to regain control over their body. What was once an impossible dream, surgery without a knife, has become an expanding frontier of medicine. The collaboration between technology and human empathy is changing the very definition of healing. The impact on patients' quality of life cannot be overstated. For decades, traditional brain surgery, such as deep brain stimulation, required drilling holes into the skull, implanting electrodes, and connecting wires to an external battery. Although effective, it came with risks: bleeding, infection, and hardware complications. Focused ultrasound eliminates all of that. There's no hardware, no implants, and no recovery from wounds. The risk of infection drops to nearly zero, and patients experience relief almost instantly. Take the example of a patient named Sarah, a pianist who developed essential tremor in her 40s. Her hands shook uncontrollably, forcing her to abandon her career. After undergoing focused ultrasound therapy, she played again within hours, steady, confident, tearful. Similar stories have emerged worldwide: a grandfather able to feed himself again, a teacher returning to the classroom, a scientist holding a microscope without tremor. These stories reveal the emotional depth of this breakthrough. Medicine is not just about curing disease, it's about restoring meaning. When a person reclaims the ability to perform simple actions, the psychological healing is profound. That's why focused ultrasound is being called the surgery of the future, because it heals not only the body but the soul, allowing people to live without fear of invasive procedures and long recoveries. But the technology is still evolving. Researchers are exploring ways to use focused ultrasound not just for ablation but for opening the blood-brain barrier temporarily. This barrier, a protective wall around the brain, often prevents medications from reaching diseased areas. By gently vibrating capillary walls with low-intensity ultrasound, doctors can create microscopic openings that close naturally after treatment. This could revolutionize how we treat brain cancers, Alzheimer's, and other neurological conditions by allowing drugs to reach areas previously inaccessible. Imagine delivering chemotherapy directly to brain tumors without surgery or systemic side effects. The potential is staggering. Additionally, scientists are studying neuromodulation using ultrasound to stimulate or calm specific brain circuits without heat, potentially treating depression, addiction, and chronic pain. This means that the same technology could help both destroy harmful tissue and restore healthy function, depending on how it's applied. The future could see portable ultrasound helmets used in outpatient clinics or even at home, making non-invasive neurosurgery accessible worldwide. However, challenges remain: cost, accessibility, and training. Focused ultrasound systems are expensive, and only select hospitals currently offer the treatment. Yet as technology advances, costs will drop, making incision-free brain therapy available to millions. The revolution is already underway. Ethical and emotional questions also accompany this transformation. When something so powerful becomes widespread, how do we ensure it's used responsibly? Doctors emphasize that not every condition can or should be treated this way yet. Long-term studies are still ongoing to measure durability and potential side effects. Some patients experience mild numbness or balance issues temporarily. Transparency and patient education are essential. Yet, despite these cautions, the overall results remain extraordinary. The procedure has given people hope where there was none. It has shown that science can be compassionate, that progress can be gentle. It represents a broader shift in medicine, from invasive correction to intelligent collaboration with the body's own systems. And on a deeper level, it demonstrates how human creativity turns sound, something we cannot even see, into a force of healing. When you think about it, focused ultrasound is a metaphor for the modern spirit of medicine, invisible precision creating visible transformation. It invites us to reimagine healing not as cutting and repairing, but as guiding and harmonizing. As humanity learns to listen to the body instead of conquering it, we move closer to a future where cure and kindness coexist effortlessly. The story of brain surgery without an incision is ultimately the story of human possibility. It reminds us that barriers are meant to be broken, whether made of bone, technology, or fear. Each patient who regains movement, speech, or freedom becomes living proof that innovation and compassion together can rewrite what's possible in healthcare. As more hospitals adopt focused ultrasound, and as clinical trials expand to treat Alzheimer's, PTSD, and brain cancer, we are witnessing the dawn of a new era. Surgery, as we've known it for centuries, is being reinvented. What once required steel and hands now happens with sound and light. And just as lasers transformed vision correction, ultrasound is transforming neurosurgery. The dream of healing without harm is no longer distant, it's happening now, one patient at a time. In the coming years, as technology grows smarter and more accessible, millions may find relief through this painless revolution. Humanity has always sought to mend what's broken, now we can do so without breaking the body itself. This is not just the future of medicine, it's the future of compassion. Brain surgery without an incision is more than a breakthrough, it's a testament to what happens when science listens to the whisper of possibility and answers with the roar of progress.